And she's a dentist. I'm wondering if she's working with the chimpanzees and as a dentist.
For orangutan habitat. I know this is a tough time of the day, I hope. But thank you very much for giving me a time to share the vision, the story of our work in Borneo, Indonesia. So as my presentation is about healthcare incentives to protect orangutans and endangered wildlife in Borneo. So I don't know how many of you have been to Indonesia, but Indonesia, how many? Almost half. Okay, good. So Indonesia consists of 17,000 islands, and there are 5 big islands. So the place that I work since 2007 is in Borneo, Indonesia. And there is a beautiful forest in this place, that a national park. And as you can see, this is a beautiful forest that orangutan live. So estimatedly that 10% orangutan Borneo live in this forest. The remaining orangutan live in this forest. And also these forests have a very high biodiversity. So one time I hiked in this forest, and I was hiking to one of a research center, and all this green, and I was start to get bored, and my biologist friend said, please find count how many leaves that you can see, and how many leaves are the same. So as I walked for 8 hours, I couldn't find the same leaves. And one time I was talking to a group of scientists there, and they were so exciting when they are collecting a sample of trees, and they said, this is the most beautiful forest I've ever seen. In 100 meter squares, you can easily find 100 species of trees. So beautiful. And me as a dentist, like, wow, like this is something I never learned before, and this is right in Indonesia, and a place where we Indonesian also don't really aware. And the Borneo Indonesian name is Kalimantan. Then actually also I just learned it comes from 2 words, Kali and Mantan. It means river and forest. So if there is no more forest, the name is not Kalimantan anymore. So this is like one hour proud. So we work with our US-based partners organization, Health in Harmony, in 2007. And we work with local community and with the belief that we all can take part in finding the solutions. But this forest in Borneo, as we can see, that the deforestation is very rapid from 1915. And in 2005, if business as usual, the forest will be gone in 2020. So we have to do something for this forest. So, but the problem is there are people who live in this forest. So in the National Park of Gunung Palung, there are 95,000 people live around the forest. And this forest also provide them good water. And this community know that they need forest. And they can see the forest, and they can see that if they protect the forest, they'll have water to to grow their rice. But they've been logging because they have some medical emergency that they never meet. So in 2007, we did a baseline survey. And we asked for 1,400 households what caused people leading to illegal logging. And one of the main reasons is medical emergencies. So people can wait to buy something, but if someone died, critical illness, they have to compromise their future with the short, very urgent need. One of our patients said that they have to, when the mother had C-section, they have to cut 70 trees, durian trees. They're not talking about this tree, but huge trees that about 50 years old to pay one C-section. These people know that they need the forest, but when the mother is critically ill, they have to compromise. So this is what's happening in Borneo, especially in 2007. And so when we come in 2007, what we did was to ask community, and we ran over 400 hours community meeting. And we asked them, if the global community willing to help you, for you to be able to protect the forest, what would you need? And there is a unity answers of all the community that we asked. They asked that affordable, high-quality healthcare, ambulance, and farming training, and doctors that they can call 24 hours. So we run community meetings, and it's in 65 hamlets that around the national park. And amazingly, they all give the same ideas, what they need. So we provide what they need for them to be the garden of the forest. So this is our clinic, and this is our nurse caring for our patients, and this is our ambulance. And also the infrastructure in this area is very, very bad. One time, we also do mobile clinics, so we provide also care, because there are people who live behind the forest that at least like 8 hours away. So one time we had a patient who had a very bad asthma attack. This girl was like 6 years old. And one time I was joined the mobile clinic, and we were already 6 hours away. And then my nurse said, "You remember a patient that came to our clinic yesterday? That man and the little girl come even behind the hills." So it's already 6 hours plus few more hours. And they came with motorbikes. This father bring the critically ill daughter with motorbikes. So there are many people really need a very urgent care. And like this woman also live very far away, so we provide ambulance care for them. And we also provide the community with organic farming training, because the cost for them is beside the medical care also to feed their kids. They said, if we are healthy, we need also have a healthy pocket. So we also need some sustainable income. So we provide them also with organic farming. So this is our. I tried to make the 10 years project into 10 minutes. So this is what we are doing now. So our clinic provides a healthcare incentive. So we have a monitoring system, and we will have the data every 3 months. So every village will have a code area. If they, we put them green red village system. If the village are not destroying the forest, we categorize the village in a green, and they will get up to 70% discount. So this is like really encourage them to be able to be green. So if one of the villagers still do logging, they will really get mad. Oh, you are the one who caused us not to become green. So like really social pressure for the community. So beside the incentive system, they have up to 70% discount. We also do non-cash payment. So as you see here, community can pay with seedlings. So I have my patient who had a very bad bone infection, and I did check with X-ray, and the bone infection was very bad, and the girl really need a very big antibiotic that's very expensive. So the father don't have to log the forest, but instead the father pay with seedlings. So this is a win-win solution. The father can get medical dental care, but also help the forest. And also the patient can pay with manure, and this is seedlings. This is, I don't know, can anyone guess what is this? This is a durian. Yeah. So we provide a non-cash payment for our patient to be able to pay their bill. They can easily pay with like durian seedlings. So they don't have to. There is no free care in our clinic, but they can still pay with service, and they can also pay with some handicraft. Yeah. So last year we managed to build our new hospital with the hope that we can expand our care. So we hope that we can do C-section in 2 years, and we are sending our doctors, and we are hoping our doctors that are coming, our surgeon, gynecologist, internal medicine, and anesthesia will start working soon. But we do have this, probably say that this is the first conservation hospital. And in this hospital, this is the waiting room. Actually, we get the grant for this waiting room as a training center. So patients, before they see doctors, they can learn about conservation education. So our team will come and teach the patients here. And behind this building, we also built this hospital environmentally friendly. So there's always things in the middle, and people, community also can learn organic gardening, or organic garden. And behind this, a mini forest. So actually, this hospital, and behind this also national park. But between this hospital and national park, there is also quite a gap of land that we can also use for education. So there is a mural painting that our volunteer did for us. This is the combination of our work. And so this hospital is not just seeing patients, but a training center. Training center for community, also for local, for global community. And not last.
Why aren't you doing any rainwater harvesting? Collecting rainwater from the roof?
Next, I'll finish this first. So last but not least, also this hospital is the Instagrammable spot. So we have a orangutan corner spot that patient can go there and have their selfie. So it's been popular. So people will come there and have their post on Facebook and like save orangutans or something like that. So it's like also helping spreading the message. So the things that we are doing is integrating environmental and health and community work. So because there is no actually one action, like people can pay with seedlings that we can pay in the reforestation, and this don't have to log the forest, but he can save the forest, but he can also increase income. So all these like intertwined solutions. And we believe that there is no action. There is no only one action, but many. But all intertwined. So to wrap up my presentation, I would like to share one things that once I was asked by a journalist a questions. The question by this journalist is, if you were granted the power to persuade the world to take just one action to help nature conservation, what would you ask for people to do? I said, We live in one world, and we all are connected. We all can take part, no matter what we are doing, where we are, be in touch and connected to the conservation work, and be inspired. It will bring you to find solutions to the complex issue of nature conservation, because there is not only one action, but many. Thank you.
Thank you very much. Unfortunately, we have only left one time for one question. He had a question. Have you an answer?
Not yet.
Not yet. Then we can take another question. Yes, please.
Thank you. You mentioned training for organic farming. What is going to happen with organic products then? I mean, where they are going to be sold? Do farmers have sustainable sailing channel or not? This is the main question.
Yes, so organic farming, when we were there, they're actually not really vegetable in the market. So even for local consumption, still very, still very good market. But also it's really improved their health nutrition. And so we encourage them also to produce more. And there is a supermarket 2 hours away from us already asks us if they can buy it from our farmers. So it's a good market. And so you're asking if why the building is not having a collecting water design? Yeah, so I think I'm not technical. We designed this with a group of architects, and there is a collecting water, but the design, they put some, what you call it, a spatial drain. Yeah. And so it's also collecting water, but this hospital has with all this new regulation of hospital, it has the elevation of the hospital is not good. Yeah, like this way. So we also have still a problem how to to have a water supply sustainable, because we need to pump the water, because also to process water it needs spatial treatment. And the new machine that we order also has a conflict with electricity, because we have to pump all the way up and then put it down again. So we still, I like to talk more about you with that, but we still have figured out about that too. And yeah, this is a way when we also connecting and get some advice and idea. Thank you.
Thank you very much to you. We go now